we are going to start with next one, tobacco. Tobacco is a type of a plant leaf. Okay, tobacco plants are naturally actually cultivated in Coimbatore district and other places. Now the tobacco is acting as medicine as well as it is acting as a drug. Now it contains a chemical called nicotine. Okay, nicotine, it is a very poisonous chemical, nicotine, carbon monoxide and tar. They are causing problem in the heart. Suppose those who are consuming this tobacco, their heart will be affected, lungs will be affected, and the central nervous system, that is brain and spinal cord, will be affected. It is smoked, that is from the tobacco leaf only they are manufacturing cigarette. So for smoking, it is smoked, chewed. That means the tobacco leaves, they are drying it and they are processing it, and a small bit of the leaf they are chewing. That is called chewed and snuffed. Sometimes they are drying it very well, making it as very powder, nice powder, and the nice powder they are inhaling through the nose. That is called snuff. Snuff means inhalation through the nose. It is snuffed. Now the tobacco increases the carbon monoxide content in the blood. That is, our blood can bear oxygen and carbon dioxide. But carbon monoxide is a poisonous or toxic gas. It is that its content will be increased. It increases the carbon monoxide content in the blood. So what the carbon monoxide will do, it will go and bind with the hemoglobin present in the RBC. Once the RBC, hemoglobin present in the RBC is binding with the carbon monoxide, then the hemoglobin cannot carry oxygen. It cannot carry carbon dioxide both. So the oxygen deficiency will be there in the body. It may lead to the death of the individual. Then it reduces the heme bound oxygen. That only, heme means the blood bound oxygen. Oxygen is binding with the heme, that is hemoglobin in the heme part. It is reacting with the heme part. So it is reducing that. Oxygen content will be very low. So the nicotine increases the secretion of adrenaline and noradrenaline. Actually, the two hormones, adrenaline and noradrenaline, are always secreted by adrenal glands. The adrenal glands are present above the kidneys. A pair of glands are present above the kidneys. So they are producing adrenaline, noradrenaline. Normally, these two hormones are secreted only during emergency condition, that is excited situation or fearful situation. But when we are consuming this tobacco, it is in the tobacco, what is there? Nicotine. The nicotine is stimulating the gland to produce adrenaline and noradrenaline, which increase blood pressure. The blood pressure is simply increased. Then it is also increasing the heartbeat rate, as a result of which anywhere the blood vessels will burst open, the heart attack will come. So that is the problem due to the consumption of this tobacco. Now we are coming to the next topic, addiction. What is actually this addiction? Now it is becoming more and more dependence. Okay, frequent consumption of alcohol, frequent consumption of tobacco, frequent consumption of other unauthorized drugs is called addiction. Okay, that means the person is totally depending on this type of unauthorized drugs. That is called the addiction. The addiction is physical, body wise, psychological, mental wise, dependence on alcohol and abused drugs, that is unauthorized drugs, misused drugs. That is, physically we are depending on them, psychologically, that is thought wise, we are totally depending upon the abused drugs and alcohol. Now the addicts means a person who are addicted for this drugs and all. Now the addicts lose job. Suppose they are totally becoming addict for this alcoholic addiction or drug addiction, then they will lose the job. Nobody will give, there is a job for them. They lose the job, they lose money because no income will be there. They lose the family, all the family members will hate them. Friends, they lose the friends, and also etc. Then addiction makes attachment with euphoria. Now already I told about what is the meaning of euphoria. So the people who are consuming this unauthorized drugs, okay, or having this simple euphoria, that is extreme happiness. They are feeling that it is giving too much of a happiness. Then excessive use of drugs and alcohol leads to the physical and psychological dependence. That is physical, that already that point is there. So physical and psychological dependence. Now at that particular stage, what will happen? They are depending on the drug or alcohol, but they don't want food or anything. So they want only this alcohol or abused drugs. Okay, physical and psychological dependence. How far it is affecting this body and the mind? We have to see. It is due to the continuous usage of drugs. That means I use drug or alcohol. They are continuously they are taking every day. Even one day, 2 times, 3 times they will consume this. Withdrawal symptoms appear if abruptly stopped. For example, they are becoming more and more addicted. So the family members, other members are stopping it. That means they are not allowing the person to consume alcohol or drugs. Then at the time what will happen? Withdrawal symptoms will be there. Now what type of withdrawal symptom? It will come, okay, later. Now withdrawal symptom, that means it will be some aggressive behavior of the individual we can find. That is withdrawal symptoms. The person will be in confused state. That is withdrawal symptom. They will be confused. They cannot be steady. There is a steady. And they protest against the absence of drug. That means they will show violent behavior on others because the drug is not given to them. Mild tremors. What is the meaning of mild tremors? Mild shivering of the hands and legs will be there. That is called a tremor. Tremor means shivering. To convulsion, from that is a slight shivering to convulsion. The jerks will be there in the body, convulsion, and sometimes it will lead to the fits. Then depressed mood. Mood will not be normal. The depressed mood means always in a confused mood they will be there. Anxiety. Then they will be very, very furious to get the drug. That is anxiety. Nervousness. That is over-excitement of the nervous system. Nervousness, restlessness. They cannot sit in a place. They can't talk properly. They cannot concentrate their mind in a particular work. That is restlessness. Irritation. Too much of irritation will be there. Then insomnia. That is sleeplessness. If night comes, they cannot sleep properly because of a lack of drug. Dryness of the throat. The throat becomes dry. Now these are all certain withdrawal symptoms will be there. Now we are coming to the other effects of alcoholism. Alcoholism means alcoholic addiction. Now other effects, what are the other effects will be present? Now whenever a person is consuming alcohol, the alcohol is going to the intestine, after that it is absorbed. Finally the alcohol is denatured in the liver. But when it is coming often, very often, the liver is damaged. The damage of the liver is called liver cirrhosis. That means in the liver, outer surface, and also inside the liver also, the tissues are dying. The death of the tissues of the liver is called liver cirrhosis. Cirrhosis means death of the tissues. Liver cirrhosis. It is very dangerous. It leads to the death. Peptic ulcer. Do you know what is the meaning of ulcer? Inflammation. Damages in the wall of the stomach and duodenum. Both together we can call it as peptic. Stomach and duodenum. That is peptic ulcer. That is in the inner wall of the stomach and the inner wall of the duodenum, lot of inflammations will be present, damages will be present. High blood pressure, BP means blood pressure, stroke, that means paralysis may occur. CAD, coronary artery disease. Now what is it, coronary artery? These are the 2 blood vessels which are supplying blood to the wall of the heart. Of course, blood is pumped by the heart, but when the blood is coming out of the heart, 2 small blood vessels are carrying the blood to the wall of the heart. That is called a coronary artery. Coronary artery disorder or diseases will be there. Then heart attack will be caused. Then Korsakoff syndrome. Now the next problem is Korsakoff syndrome. It is chronic memory loss or memory disorder. Now what is this memory disorder? Now very often that individual is forgetting. That is called a memory disorder. But it is chronic. Slowly, gradually, over a long period of time, they are totally losing their memory. That is called chronic. Chronic means any problem is arising for a long period of time. That is called a chronic memory disorder or memory loss. That also we can say. Now we are coming to prevention and control. How to prevent and how to control this addiction. We have to see whether it is alcoholic addiction or drug abuse, whatever it is. Having good peer group. Already I told you, peer group means our same age group. Now, same means not exactly the same. Maybe 1 year elder or 1 year lesser, whatever it is. The peer group, more or less the same equal age group. that age group friends must be good friends. That is called a peer group, good peer group. That means when the good peer group is there, we are always directed in a right path, we will not go to the wrong way. Seeking help from parents and good friends. See that once again, parents. Parents are always very, very important for this particular age group. That is 12 to 19. Parents. Now we have to treat them as the best friend. That is parents and good friends. Now friends, they are not telling simply friends, good friends, because good friends will always guide in a right way. Then education and counseling. Now education, through education we are making lot of awareness, and also the counseling program will be there. Normally the counselors will be there. They are one-to-one. They can solve the problems. They will try to find out the solutions for the problems. That is counseling. Next one, teachers and parents need to see any sign of addictions are there in any children. So the teachers, not only teachers, even parents, they must see that whether any changes are there in the behavior of the children. Then only they can identify whether they are addict or not. Then professional and medical assistance. Now professional means that voluntary organizations will be there. Rehabilitation centers they will be running. So there also they can be taken, they can be sent for treatment, or medical assistant. Doctors also can give some proper treatment for this. That is a relief from the addiction. That is professional and medical assistance. Then mental health, that is mental health, our mind. Our mind should be always stable and it should be perfect. Then only we can be very conscious, we can be very cautious, and we can do our work daily. So mental health. So we have to keep our mind in a healthy way. Now what is the mental health? We have to say well-being of the mind. The mind should be in good condition. Self-esteem. Now we should know what is our that is a capacity, what is our skill, what is our capability, everything. Self-esteem. Positive thoughts should be there in the mind. We should not allow the negative thoughts, positive thoughts. Then appreciated and rewarded by the society. The way we move with the society, the way we move with the other people, we must be appreciated and we must be rewarded by the society, by others. Then creative mind. So whenever the mind is a positive, it will be creative. Now it will always think new things about it. And a cooperation with others. Mentally they can move or they can adjust with others. Then depression. It is a problem in the mind. That is depression generally is given. It is mental depression. Now what is the meaning of mental depression? Depressed or suppressed mood. That means a mood. Mood is the, what is the something we can say that interest. Mood is the interest. Now the mood or the interest is a depressed or it is a suppressed. That is called a depression. Loss of interest or pleasure. That means no interest at all. We are not showing any interest in our studies, in talking with others or doing something good and all. That is loss of interest and a loss of pleasure. What are the things we have to enjoy? Even that we cannot enjoy. Then guilt. Always they have the superior, that is inferiority complex, guilt and a low self-esteem. That means the individual may not understand what is the capability of the individual. Then disturbed sleep. Okay, they cannot sleep properly. Poor appetite. Appetite means feeling hungry. Now poor appetite means they are not feeling hungry. So they can't consume the food normally. That is poor appetite. Lack of concentration. The mental concentration will not be there. Whether it is reading or it is the profession what they are doing, they cannot concentrate their mind 100% in their profession or in studies. Then signs of mental depression. Suppose one person is having mental depression. Others, how to identify? What are the symptoms or what are the signs we can identify from the person? Loss of self-confidence or self-esteem. Okay, self-confidence will not be there in the individual. Even if we know the capacity, if we are telling that you can do that work, they will say that no, I cannot do. Now that type of negative thing will be there. That is called a loss of self-confidence or esteem. Anxiety. That is too much of over-excitement. Anxiety will be there. Not being able to enjoy the things. They cannot enjoy anything in the life. The remedy for depression. Now, what are the remedies? Suppose a person is having, there is a depression, mental depression is there. Now, how to get rid of from the depression? We have to see. Changing the lifestyle. The lifestyle must be completely changed. Like, they have to do exercise, physical exercise. They have to do yoga. And they have to change the food habit. Okay, 3 things they have to do. Physical exercise, keeping the body more active. and also a lot of energy will be spent on that. Yoga, it is an exercise for the mind. Okay. Then food habit, what is the suitable food for our climatic condition? That type of natural food we have to consume. There is a healthy diet. Regular exercise makes the production of serotonin and endomorphins. Okay, endorphins it is given, endorphins, shortly we can say. Two type of hormones will be secreted whenever we do physical exercise. These two hormones, serotonin and endorphins, they are keeping our body in active condition. So we will not feel that much of tired for a long period of time. That is the importance of regular exercise. Then exercise, yoga, healthy food habits will bring self-esteem, self-confidence, sense of empowerment. That means sense of empowerment means it is our capacity, okay, we can do this much. That is the achievement, actually we can say. That is sense of empowerment and enhance social connections. That means we can easily move with the society and also with the relationship. Any type of relationship we can move very well. So the healthy relationship will be present. These are all the remedies.